I'm Dr. Michael Mwachiro from surgical endoscopy. And today we'll be discussing a little bit about cholangioscopy, which is one of the newest innovations that we are happy to be able to offer. In essence, cholangioscopy is a technology that allows direct visualizations of the biliary tree. And usually when patients come with disorders that require endoscopic retrograde cholangiopancreatography or ERCP, we usually do this to handle obstructive jaundice or blockage of the ducts, which leads to yellowness of the eyes. And when you do ERCP, we're able to get into the duct using a wire. And usually for that, we do something called fluoroscopic assisted procedure. So we use the X-ray images to be able to look at the biliary system as we are doing that. The difference with cholangioscopy is that cholangioscopy uses what is called a spyglass. This gadget has a camera, a very little camera, and it goes through the duodenoscope, and it is able to go into the bile duct, and we're able to visually see using the camera into the duct. And so the advantage it offers is that we're able to look at whatever pathology is going on in there, whether it is tumor, and do direct biopsies, or if it is gallstone disease that are very big and are causing blockage, we can actually break down these stones into smaller fragments, which we can then remove. And so it's exciting that this technology is now available locally, and that we're able to offer patients who've had challenging cases. For example, if you've been unable to remove particular stones, or they are impacted, or they are very large, we are able to go in with a spyglass system, break them into smaller pieces, and then remove them. So I think it really makes a difference for these patients who've had multiple attempts to remove the stones. People would ask, why this technology? It's really because it offers a more sure way of looking at the pathology and actually seeing it and being able to offer interventional techniques. If it is tumor, you're able to biopsy it. However, it is also can be used routinely as part of diagnostics for some diseases, like patients who have multiple strictures that we don't know what exactly is causing them. We can actually use this camera system to go up into the biliary tree. So which patients are we interested in? I think any patient who has yellowness of the eyes, who presents to the clinic with what we call jaundice, and usually they'll have itching, they'll have yellow hands, the yellow mucosal surfaces on the eyes, the tongue. So these patients need to come for a review, and usually for ERCP, we are able to offer these services where we either, for those who are able to be treated, we can put in a stent to open the blockage. For those who the cause is stones, we're able to remove them. So I think the message is that if a patient, or if somebody that you know or a relative has got yellowness of the eyes, weight loss, itchiness, they need to come for an evaluation. At the same time, this is always a good opportunity to just say anyone who has symptoms like weight loss, difficulty in swallowing, painful swallowing, or blood in stool, they should also come just for a regular checkup where we can do a diagnostic endoscopy, either of the upper gastrointestinal system, or we can do a colonoscopy and look at the lower gastrointestinal system. And if we find something, then we're able to offer the appropriate care and help these patients get on the proper management pathways. So I think it's exciting that we are able to offer comprehensive gut care for our patients. And it's good to see this milestone of having the cholangioscopy system available in the country, and that we're able to offer patients this next level care.